Schizophrenia, a mental disorder characterized by persistent symptoms of psychosis involving disturbances and disorganization of thoughts, perception, feelings, and behavior. Many people with schizophrenia have an altered perception of reality, often a significant loss of contact with reality.
Delusional disorder is a type of serious mental illness in which a person cannot tell what is real from what is imagined. A delusion is a false belief that is based on an incorrect interpretation of reality.
The diagnosis for schizophrenia is that the symptoms need to be present for 6 months or more and can be severe enough to cause problems in functioning at work, school, home, or socially. Diagnosis of schizophrenia often rules out other mental health disorders, and determining that symptoms are not due to substance abuse, medication, or a medical condition. Determining a diagnosis of schizophrenia may include a physical exam. This may be done to help rule out other problems that could be causing symptoms to check for any related complications. Tests and screenings. These may include tests that help rule out conditions with similar symptoms and screening for alcohol and drugs. The doctor also may request studies such as an MRI or a CT scan. Psychiatric evaluation is a doctor or a mental health professional checks the mental status of a patient by observing appearance and demeanor and asking about thoughts, mood, and delusions, hallucinations, and substance use, and potential for violence or suicide. This also includes discussion with family and personal history.
Diagnosed delusional disorder, the doctor might use various diagnostic tests, such as x-rays or blood tests, to rule out physical illness as the cause of your symptoms. If the doctor finds no physical reason for the symptoms, he or she might refer the person to a psychiatrist or psychologist, which are healthcare professionals who are specially trained to diagnose and treat mental illnesses. Psychiatrists and psychologists used specially designed interviews and assessment tools to evaluate a person for a psychotic disorder. The doctor or therapist bases his or her diagnosis on the person's report of symptoms and his or her observations of the person's attitude and behavior. The doctor or therapist then determines if the person's symptoms point to a specific disorder as outlined in the Diagnostic and Statistical Manual of Mental Disorders, which is published by the American Psychiatric Association and is a standard reference book for recognized mental illnesses.
Symptoms of schizophrenia/delusional disorder. The DSM-5 defines psychotic disorder in terms of key symptoms. These symptoms are generally described as either positive or negative. Positive symptoms are experiences and behaviors that have been added to a person's normal way of functioning. These include hallucinations, delusions, disorganized thinking, speech, and behavior. They are in addition to how the individual usually thinks, feels, and behaves.
Normal activities, loss of motivation, and a decrease in the intensity of emotional expression. Symptoms may include such things as delusions, which is a fixed belief that is held with absolute certainty, even when there is a strong factual evidence that does not support this theory. Delusions usually involve a misinterpretation of actual information or experience.
It's thought that schizophrenia is caused by complex changes in brain functioning, but the causes are not fully understood. There is no single cause. The condition usually develops in people who have a combination of genetic and environmental. Hallucinations. A hallucination is a perceptual experience during which the individual sees, hears, feels, tastes, or smells something that is not actually present in reality. Although hallucinations can occur in any of the senses, the most common are ordinary hallucinations, which involve hearing voices. Ordinary auditory hallucinations may be experienced as being heard through the ears, in the brain, or mind, from the body, or anywhere in eternal space. Disorganized speech, slash in brackets thinking, disorganized speech reflects on disorganized thinking. What it is said is often not organized in a particularly meaningful way. Speech can be disconnected, jumbled, and can sometimes be all over the place. Abnormal motor behavior. Behavior that often appears to be fragmented, inappropriate, unusual, unpredictable, purposeless, and erratic. This severely affects the ability to perform the usual activities of daily living. Biological factors. There is considerable research evidence that individuals can inherit a genetic predisposition to developing schizophrenia. Numerous studies of family histories of people with schizophrenia have found that the disorder tends to run in families, more so than any other mental disorder. Not even sharing 100% of genes means that the disorder will definitely develop. No single gene has been identified
Some
as being.
psychological factors is that schizophrenia is not a stress disorder, and stress in itself does not cause schizophrenia. There is considerable research evidence, however, that stress can trigger its onset in people who are more vulnerable to developing the disorder, or worsen the symptoms for those who already have it, for instance. Studies also show that people with schizophrenia tend to perform poorly on a wide range of memory tasks, particularly short-term, quote, working memory, which involves the process of information for just about everything we can consciously do on a daily basis. People with schizophrenia tend to retain less information in this memory system and also process information more slowly.
Social factors. Most research on social factors has focused on how different family environments may contribute to the development or experience of schizophrenia. Researchers have investigated such factors as dysfunctional parenting, disturbed family communication styles, and parenting styles that are constantly critical or induce guilt. Treatment for schizophrenia. Medicine is the main form of treatment for schizophrenia. The antipsychotic medicines can reduce the main symptoms like hallucinations and delusions and normally take up to 6 weeks to start working. A new generation of treatments have been developed, including risperidone, quetiapine, clozapine, and many others, which I cannot say. Some people develop side effects to medicine, so it's important to have regular appointments with psychiatrists or doctors. People respond differently to medicine, and sometimes it's necessary to try more than one type before finding the ideal medicine.
Family therapy, as this provides support and education to families dealing with schizophrenia. Vocational rehabilitation and supported employment, as this focuses on helping people with schizophrenia prepare for, find, and keep jobs.
Delusional disorder is less common than schizophrenia. Delusional disorder is distinguished from schizophrenia by the presence of delusions without any other symptoms of psychosis. The treatments of schizophrenia and delusional disorder are exactly the same, as they are both psychotic disorders. The symptoms are very similar, as they are both representative of hallucinations. The differences between the two are their physical examinations are very different, as delusional disorder has x-rays and blood tests to diagnose the issue, whereas schizophrenia